So there are, dear Professor, we are glad to meet you in Russia, and we're happy that you brought very good news to Russian patients. I hope so. So my first question is, I have some specific questions, just I would like to ask you. So the first question is, what do you think about the habit of a doctor to indicate the chemotherapy for the patient of the hormone positive, HER2 negative patients without visceral cries, instead of wonderful, effective combination of endocrine therapy with inhibitor SDK4 and 6?
Yeah, I think right now the evidence would indicate that before chemotherapy, these inhibitors should be tried because they don't have the side effects of chemotherapy, and it looks like they have more effectiveness than chemotherapy. So there's two issues. They're more effective and they don't have all the side effects. So I think that the way the diseases should be treated is initially with a CDK inhibitor.
And in America, the practice, which is?
Yes, it has changed now in the last year, and it's changing rapidly even more, that the CDK therapy is dominating what we're doing.
Thank you very much. And the second question, please, can you comment the new indication of ribociclib based on the researches MONALEESA 3 and 7, particularly to the patient in premenopause in the first line and in postmenopause in the first and second line in the combination with fulvestrant?
The first line standard therapy with aromatase inhibitor, I think, was already done with MONALEESA 2. What's exciting about MONALEESA 3 and MONALEESA 7 is premenopausal patients look like they benefit as well, and patients who are just initially being treated, who haven't seen hormonal therapy or seeing the first time hormonal therapy, they benefit as well compared to the best available standard therapy. So I think the field is moving very rapidly that this new class of drugs is very effective for these patients and should be included in their therapy earlier rather than later or last.
So in the first line?
Yes.
Yes, and the last question is, not the last, but before last, who is the patients of this group? How do you describe the profile of the patient to whom is indicated the combination of ribociclib with fulvestrant in the first line?
Right now, the biomarkers are hormone receptor positive, HER2 normal. That's what the current indications are. There may be better tests that will even refine it more, but those are in development and being looked for now. But right now, ER positivity and HER2 normal or HER2 negative is what the biomarkers are.
So, okay, and about alpelisib. In the patient after the progression on ribociclib, what do you think? What is your opinion?
So you're talking about the PI3 kinase inhibitors, yeah. The preclinical data looks very exciting, and the early clinical data looks very interesting. We need more information, but I think that just using, if a patient progresses after CDK therapy, just using another CDK inhibitor would not be effective, but going to a PI3 kinase inhibitor makes more sense. So that's where I think the drug you're talking about now is looking like it may have activity.
Yeah, okay, thank you very much. And then the last few words, just wishes or opinion about the Congress you're visiting.
It's very exciting. There's a lot of going on. It's exciting to be here with some of the investigators, the Russian investigators with whom we have collaborated in the past.
Thank you very much. We will be waiting for you again and again with good news.
Thank you.